Okay, so here we have the second part of chapter 6, which is our excretory system, our urinary system. So we are going to see that in our disease and disorder terms built from word parts. What do we know about built from word parts? We can separate them into our word parts, and then we can define them. Like in this case, cystitis. My line would go right here between cyst and itis. We know itis means inflammation. From this chapter, we learned what cyst was. So we could put those together. Remember, all of these built from word parts you can do without memorizing anything. You already know these. Okay, the next thing we're going to move on to just some more built from word parts. Not built from word parts. I gave you a list of the ones that I want you to focus on in the chapter exercises, so please be sure you know those for the test. I want to call your attention to this renal hypertension. Renal means our kidney. Hypertension we usually associate with a person. We say, oh, they're hypertensive or they have hypertension, which means they have high blood pressure. And if you have renal hypertension, it means that the blood pressure within the kidney in itself is too high, and that could be dangerous, and it could lead to kidney dysfunction as well as potential loss of the kidney. One thing that's very common, a UTI, you'll hear it referred to as a UTI, a urinary tract infection. And that's going to involve usually the lower part of the urinary system. Here's just a picture of a urinary tract infection. You can see that the bladder's been cut open. This is the bladder port. See these little cysts in here? That's cystitis. Okay, here we have some more surgical terms built from word parts and some not built from word parts. Let's go straight on to our diagnostic terms again. Our diagnostic terms, you're going to see the same things over and over again. A nephrotomogram, excuse me. Look how clear you can see the kidneys here. You can see the kidney. You can actually see the ureter that's coming from here. This is a sonogram or an ultrasound of the kidney itself. Again, in our diagnostic images, we have laboratory images laboratory findings that we can use to diagnose those malfunctions in the kidney. And we have complementary terms built from word parts and not built from word parts. Some of these are going to be very familiar to you, like catheter. You know that's like a tube that can be inserted through the urethra and into the bladder to drain the bladder if a person's having any sort of bladder or urinary tract issues. Distended just means that, like, if a person's abdomen is distended, it means it's just real swollen. Hemodialysis, that's going to be a term that is going to be familiar to you because it's going to be our discussion topic for this chapter. We're going to talk about hemodialysis. Incontinence is when a person can't control their bladder. And it can happen for a variety of reasons. It can be anything from a side effect of a medication that they're taking to something that's physically wrong with the bladder itself. Urinary catheterization is the same thing. The catheter is the instrument and urinary catheterization is the process. Here are our abbreviations for this chapter, as always. Remember your abbreviations, and because you'll see them on the test.